Hi, welcome to All Things Home Care with Dana Arnone. I'm your host, Dana Arnone, a registered nurse with over 30 years of home health care experience. In today's show, we address food insecurity. In the studio today, I have Mary Coyle. She is a licensed clinical social worker and program director at EAC Meals on Wheels. We then go on the road for our tour of Island Harvest, and in our Ask Dana segment, I will answer your most pressing questions. Today we have Mary. So Mary, I welcome you to our studio. Let's talk about Meals on Wheels as a program and EAC.
So Meals on Wheels is a wonderful program for homebound seniors in Nassau County. You know, I've been involved with EAC for 6 years and providing home delivered meals, also part of the senior case management, which means that we link seniors to other services that can keep them in their home and keep them living independently with dignity.
I'm curious as to the number of referrals that Meals on Wheels have gotten prior to COVID and since COVID, and has it changed the way you deliver meals?
Yes, it has. Since COVID, our numbers have skyrocketed. We got so many calls from people needing home delivered meals because they were alone, they were afraid to go to the supermarket, their family wasn't able to help anymore. They were in crisis. Our staff were fabulous. We were able to get them the food. Our criteria was laxed. Anybody over 60 who needed the food, we provided the meals, and we were a lifeline for those people.
So what would you say the typical amount of meals that were delivered pre-COVID versus after COVID?
Pre-COVID we were funded for 185,000 meals.
For the year?
For the year, yeah. And then during COVID, that we were serving 220,000 meals.
That's amazing. It's almost double.
It really was amazing.
What is the intake process?
Typically, we would get a call. It could be a self-referral. It could be a family, a friend, or a neighbor. We get calls from doctors' offices, social workers, hospital discharge planners.
If someone wanted to access the assistance, where would they call? How would they reach out to you?
Okay, so they would call our office in Long Beach, 516-992-0081.
What is the criteria for someone to be eligible?
You have to be a Nassau County resident, 60 years and over.
But there's another program for Suffolk County and in the boroughs? Okay.
Yes.
So we're specifically talking about Nassau, right?
Yes,
Okay.
Nassau County, 60 years and over. And you have to be homebound. You have to have impaired mobility, meaning that you can't leave your home without assistance. You have to have difficulty either preparing meals, shopping, or cooking.
And what if they had care in the house, though? So a lot of times people will call up and they would talk and they say, well, I have an aide, but I still need Meals on Wheels. Does that limit what they're receiving from Meals on Wheels?
Well, it all depends. The way it works is that the case manager will complete a comprehensive assessment, and if somebody has less than 4 hours, like somebody might just have a bath aid for an hour, that wouldn't rule them out for home delivered meals. But if somebody has 24-hour care, yes, typically that would, because they already have a support system, so the aide should be cooking the meals.
We find that sometimes they may have the care in the house being provided through Medicaid, but that doesn't mean that they have the resources for healthy, nourishing meals. So we are now making some referrals to Island Harvest. So in this situation, we can actually have a meal delivered to our patients.
Yes, if during the assessment we find that the person needs the meals, we will provide the meals.
So what does a meal look like? Has it changed since COVID? Like prior to COVID, were they getting a variety of meals? Did they get to have choices?
So prior to COVID, we were providing frozen meals and chilled meals. And then because of COVID, we switched it to all frozen just because it was so easier to manage. And we had to actually change the way we deliver food too. We had to do contactless delivery. That was hard because part of providing home delivered meals is a well check. Prior to COVID, the person would hand the bag of food over, maybe sit it on the person's walker, because it can be quite heavy for somebody. During COVID, they couldn't do that. They had to drop the meal at the door, back up for the 6 feet and then wait till the person came out, and they had to wear a mask and gloves, and it was different, but we managed it.
What people don't realize or think about is that human contact, they become, that's a little bit of a socialization for the person.
Loneliness is terrible because people, a lot of the times, our drivers are the only person the client might see.
I know.
They might have a daughter in California that they talk to on the phone, but it's different, I think, if you have somebody who knows you, dropping you off your food and having a little banter. It's so healthy psychologically as well. And, you probably have seen the studies that loneliness is a killer.
Well, they say that the meal needs to be social in order for people to eat the meal. So like when you're going out to dinner, you're sitting with your friends, you're at home, you're sitting with your family, you're having a meal, you're eating. But when you're alone and you don't have that, it's
yes.
That's so important. So we were talking before, we'll give that phone number one more time, because I know that you were saying that from the time of the intake, meaning the phone call comes in, they're going to get assigned a case manager. They're going to go out and see the individual and do an assessment.
Yes.
And that takes anywhere from 1 to 10 days, you said.
Officially, we see people within the 10-day period, but usually we see people within 3 or 4 days because we don't have a waiting list. We're so fortunate that we don't have a waiting list. No senior who needs food should go hungry.
So Mary, I understand that Meals on Wheels is a regional program, meaning that there's different locations and there's different programs that offer Meals on Wheels?
Yes.
So if someone wants or is in need of a meal not in your area, what would they do?
If they contact EAC, the first thing we'll ask them is, where do you live? Because depending on where the person lives in Nassau County, another agency could be providing home delivered meals, for example, Catholic Charities. So we always check and we always give the person the information. We'll not just leave them hanging.
Is there a central number that they can call?
Yes, they could call Nassau New York Connects helpline, and that's 516-227-8900.
Is there any type of monies that is due for Meals on Wheels? Do you charge people?
We don't charge for the program, but we do request that people make a voluntary contribution if they can afford it. The more voluntary contributions we get means we can put more people on the program.
Well, thank you, Mary, for taking the time out to speak about Meals on Wheels. Coming up next, we go on the road to Tour Island Harvest to see how they're helping families put food on the table. We'll be right back. Welcome back to All Things Home Care with Dana Arnone. In today's show, we address food insecurity. So I went out and about for a tour of Island Harvest to get a first-hand look at how they're helping families put food on the table. We are out and about today. We are visiting with Allison from Island Harvest. Hi, Allison. How are you?
Oh, it's so great that you could come by today.
Yeah, I'm so excited. So let's tell people that are not familiar with Island Harvest exactly what is it.
Here at Island Harvest, as a food bank, our goal and mission is to end hunger and reduce food waste, and we do that through servicing our member agencies. We have a network of food pantries, soup kitchens, and shelters across Long Island where we're able to give them food, we're able to give them support services, and we help them in many different ways. COVID has been huge, and there's been so many things going on, and we've been working with them to make sure that we can really help those who have been affected and are still being affected by COVID.
We're in Melville right now in your newest location. So what's here that's different than your Hop Hog location?
Right now we're using this site as a packing site. So we have targeted programs where we're able to address different populations. So anywhere from veterans to seniors and children. In this site, we're packing each month 3,000 boxes which contain dry and shelf-stable food that we deliver to the homes of seniors across Long Island. There are 3,000 seniors who are now relying on this program because they know that it's hard to get out and they're a little fearful to go into the stores and leave their homes. So we're able to go to their homes and make the delivery in a touchless environment.
What would be their needs in the home in order to qualify?
The program that this is called the Commodity Supplemental Food Program. It's called CSFP. With this program, we receive the food through the USDA, and we're able to give food to really the most vulnerable seniors across Long Island. They have to earn about $1,300 to $1,400 a month with the income guidelines. And so if they earn it more than that, then unfortunately they're not able to receive the boxes.
Is there a difference between Island Harvest and how you distribute your food versus Meals on Wheels?
Yes, so Island Harvest primarily does food that needs to be prepared. Meals on Wheels delivers prepared meals to homes, mostly seniors or people who are disabled. And so we are able to get the food and then provide menus and also different recipes to help them use the food that they're getting.
I'm not sure if COVID has changed this, but with Meals on Wheels, if they had care in the home, if they had a home health aide or some type of companion, they weren't entitled to the services of Meals on Wheels because they figured that that person could help cook. Is that the same for you?
This program only asks for a copy of their ID to show that they're within the age range of over 60. They have to be a New York State resident, and and they have to meet the income guidelines. So outside of those three things, we're not asking any questions.
If they have a caretaker in the home helping them, that doesn't disqualify.
That is not a factor. Neither is whether they are a U.S. citizen. And so there are a lot of federal programs that if you're not a U.S. citizen, you may not qualify, but this program welcomes them in.
Do they get weekly visitations and weekly food packages going to the home?
We partner with over 50 sites across Long Island where we go to their homes, which are mostly senior housing complexes. And so we also have in our Hop Hog site open hours on Tuesdays and Fridays. So any senior who qualifies and is enrolled in the program, they're eligible for this program for 3 years. And so after that 3 years, they re-enroll, show us their documentation, and then they can be a part of that again.
As a nurse, I always think about what's going on in the home. So if someone goes to the home and that individual can no longer prepare the food, or they're having some medical issues that you're bringing them the food but they can't prepare it, is there a help for them after that? Do you refer them someplace else?
So we do work and refer to Meals on Wheels and other programs. There's Mom's Meals, and so there's a number of different resources that we try to connect them with, but unfortunately if they're not able to cook this food, we don't have the support for that. But it is food that is can be prepared, so anybody is able to go into their home, family members and whatnot, to be able to help them with that.
We see a lot of food here. We see a lot of packages. Where do you get most of the donations from?
We have a lot of different sources where we get food, whether it's a manufacturer, a retailer, or we're even going to our farms locally. So there's a lot of different donors that help us supply our food sources. And so right here, these boxes, they are coming from a salvage location in the Massachusetts area. And so when a retailer brings the food that they're not selling, this warehouse collects all of that. And when they fill the boxes, then we get them so that we can give them out. Pretty much one truckload is an example. We'll get 24 of these pallets, and that truckload will be gone by Wednesday if we receive it on Monday. Food comes in and out very quickly. We're not looking to store the food. We're looking to bring the food in so that we can make sure that people have it in their hands as quickly as possible.
When people get that package of food, they look forward, I'm sure they look forward to the delivery. They look forward to what's in the box, because I'm sure it changes, so it's kind of like a surprise. But also, what's going to happen to them? Are we going to remove that from them? Because it becomes part of their budget. And it becomes part of, I guess, their expectation of their meal plan. So what is the plan for those individuals?
We were distributing about 9 million pounds a year before COVID. And then when all of the people became unemployed or they had issues with COVID and they became more reliant on food, we are now moving about 16 million pounds of food a year.
Amazing.
And that's such a substantial number, and it's amazing to know that we can help and move that much food out into the community. But we anticipate seeing a drop in the upcoming year as people become more employed. But there's also other programs like SNAP benefits. SNAP is Supplemental Nutrition Assistance Program. This allows them to get money to buy the foods that their family really needs.
Right.
And so as much as I love to give people food that has been donated and that we're able to give food out into the community, it doesn't always meet the cultural needs or the even the taste needs of that family. Whether it's a child who is only eating chicken nuggets right now, as much as I don't want them to have chicken nuggets, you want to make sure sure that the family is getting the things that they like.
So going from 9 million pounds to 16 million pounds on Long Island, it seems like people would think that that's unusual because Long Island seems to be the place where people have means, where they don't really need that type of help. So it's interesting to know that there is a population here that has issues.
Really, people of all ages were seeking out food deliveries because due to people's poor immune systems or whatever the situation was, they weren't interested in leaving because they were so fearful of becoming ill, and many lost their lives. And so on Long Island, there is such highs and lows of income, but the people who are living really at the basic level, one hit for them, whether they lose hours at their job or they lose their job and one income in the household in whole, it's completely detrimental to that household.
Yeah. So why don't we take a tour of the warehouse because it's very large.
Great.
Welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. So let's get right to your questions. First question we received is, how should we adapt our eating as we get older? Well, I'm scared for this answer, but if we've always been practicing healthy eating, most of us can continue on the same course. People with certain health problems may be prescribed a special diet. For example, some people might be on low sodium for when they have high blood pressure, or a soft diet for those who have chewing or swallowing difficulties. But as we age, our sense of taste diminishes, and so we might prefer some extra seasoning on our food, but definitely not salt, of course. Next question, is it worse to be overweight or underweight in our later years? I, for one, am going to be overweight when I get to 90, because by that time I'm not going to care, to be very honest with you. But most gerontologists will continue to study the relationship between age-related conditions and maintaining a healthy weight. Doctors have always worried about seniors who become seriously underweight, but today more and more seniors are struggling with obesity. As we age, though our need for nutrients does not decrease, we usually require fewer calories for our energy needs. So we need to choose nutrient-rich foods to maintain a healthy weight. Yet many seniors gradually start to eat junk food that has little or nutritional value. A senior can be seriously overweight yet still suffer from malnutrition. Another question is, for years Americans were urged to follow a low-fat diet. Should we continue to limit our fat intake? That's a great question. Today's seniors have lived through quite an evolution of our understanding of dietary fat. They were raised on bacon and eggs for breakfast, cold cuts for lunch, and a big steak for dinner. They later followed advice to lower their cholesterol by switching to a low-fat food, some of which, it turns out, was just as bad, high in refined carbohydrates and sugars. The American Heart Association recently stated that while it's important to limit unhealthy saturated fat and trans fats, it's just as important to consume enough of the healthy polysaturated and monosaturated fats that may lower cholesterol and the risk for heart disease and dementia. The American Heart Association offers a lot more information on healthy fats. Another question we got is, I've been reading that fish is rich in good fats. They call it brain food, but I'm worried about the mercury content. What should I do? A February 2016 study published by the American Medical Association confirmed that while eating seafood can lead to higher levels of mercury in the brain, this does not lead to a higher risk of dementia. On the contrary, the researchers found that eating seafood at least once a week was linked to a decrease in the plaque and tangles that lead to Alzheimer's disease. Fish is a healthy Mediterranean diet, which you can read about on their website on the Academy of Nutrition and Dietetics. Next question, do I need dietary supplements? Before purchasing any type of vitamins, healthy shakes, and herbal products or other supplements, your first step should be ask your healthcare provider about supplements that might benefit you. The supplement industry is huge and largely unregulated, and for many companies, they pitch their markets to older adults. Certain supplements have been proven to be effective. For example, a special vitamin formula is at present the only treatment for certain types of age-related macular degeneration, and some vitamin supplements are beneficial for seniors who can't get all their nutrients that they need from their food. But remember that a TV infomercial or a fancy website doesn't mean supplements are beneficial or safe for that matter. Save your health and save your money, and talk to your doctor first. Well, that's all the time we have this week for Ask Dana. Please email me your questions at info@allthingshomecare.org. Hi, welcome back to All Things Home Care with Dana Arnone. In today's show, we address food insecurity. We visited Island Harvest to see how they're helping families put food on the table. Here's the conclusion of our story. So Allison, why don't we take a tour of the facility?
Yes, let's walk around.
Very good.
We have about 50 employees here at Island Harvest, and I believe since COVID, we are up to about 12,000 volunteers.
Wow.
I chose to work here because I was volunteering and I wanted to do something bigger than myself. And it could happen to anybody at any time, in any moment. You could become unemployed, and food is something that costs you money. If you could save some money on somebody for food, they can spend it elsewhere where they need it. It's almost selfish. You feel very gratified that you can do that, and you know that that could be you at any moment too.
In this facility, we're using the space to bring shelf-stable and dry food in so that we can sort it and prepare it for a program such as the CSFP senior program. And so here we have anything from toilet paper, paper towels, to dry products such as rice and pasta and, requested items. We have some donated food, and so when we work with donations, then we don't always get that choice. But when we purchase food, we're seeking out foods that the agencies are requesting. So we work with the JCC, and they are helping to get kosher food out to the community. We also are working with the Islamic Center so that we can make sure that people who need halal food, but it really goes into every culture because we need foods for people who don't have kitchen facilities in their home. So if they don't have microwaves or ovens, what foods can they eat? If it's somebody is, if kids are home alone and they don't know how to cook, then we need foods that are available to them. So really it goes beyond the culture, and it goes into what the home needs are. These senior boxes, so there's everything from rice in here to that is non-fat dry milk. There's chicken breast, there's cereal, juice, beans, peanut butter. There is canned fruit and canned vegetables. So there's a nice variation of foods here. Some of the items they can make to create meals, and then other food is there so that they can support the food that they may already have in their pantry. We don't receive just food. We also receive what would be considered non-food products. And so that's anything from what you saw, the toilet paper and the paper towels before. These are some of the sterilizing wipes that All Things Home Care has shared with us. Actually, this is a nice size wipe, so a senior could take them with them when they go. So if they want to wipe down handles, or if they're going to the doctor's office, they can bring this with them. But there's enough here so that everybody can get, a number of packages to help them get through the next couple of months.
Yes.
We are going to be going under construction soon so that we can bring in a whole walk-in freezer and refrigerator in this space. So that way we can store and we can bring in more food. In each day, we're moving about 150 pallets of food. And so we need to have this space to be able to keep up the momentum that we've built over COVID, because we know that we're reaching people that didn't know we were there before. Our office line here is 631-873-4775. But we also have our website, islandharvest.org, where people can reach out to us and we can try to connect them to the best service that's in their area. Our programs allow us to actually provide bus passes to people who are in Nassau County. So we have a lot of services, and we are really just looking to do the best that we can to make connections and make people feel comfortable with the process.
This is the end of our special show on food insecurity. If you or someone you know needs assistance, you can find the numbers and links to today's guests on our website, allthingshomecare.org. Please follow us on Facebook and Instagram. We'll see you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.